Welcome back to Politics Nation. This week, President Trump signed an executive order to bring the presidential fitness test back to public school. The fitness test was first established by President Eisenhower in 1956. The original version called for students to complete 40 push-ups, 10 pull-ups, and a 6.5-minute mile. Joining me now is Dr. Uche Blackstock, CEO of Advancing Health Equity. Doc, will this help? As you know, I take my health and physical shape very seriously. I have a pretty strict exercise routine that I follow every day. I'm in the gym at 5:15 in the morning. And we all know that obesity and the obesity epidemic is real. Physical Activity Alliance that found that more than 70% of children and 85% of teenagers did not meet the 2024 federal minimum recommendation for daily moderate to vigorous physical activity. And those numbers are higher for children of color. Could bringing back this test help with that, or is this an antiquated idea?
Yeah, well, first of all, thank you so much for having me, Reverend Al. What I would say is this policy feels very performative, and it feels like political theater. The reason why is, yes, you're absolutely right that our children probably are the least healthy they've been in a very long time. But a test that assesses how many sit-ups or push-ups they can do is not going to solve the problem of childhood obesity. And so what we need is policies that address the structural and root causes of these issues. And we know a lot of it is due to lack of access to healthy food, the fact that we have a healthcare and a public health system that is broken, the fact that our children may live in neighborhoods where they can't exercise, the lack of recess, physical education, all of that makes a difference. And so if you're just going to say we're going to do a test but not address those other causes, then we're not going to address childhood obesity.
Trump signed the executive order flanked by professional athletes whose careers peaked decades ago, like NFL Hall of Famer Lawrence Taylor and professional wrestler Triple H. Do you think the administration has done enough to make this initiative appealing to younger people today?
No, I don't think so, because honestly, to run a 6.5-minute mile, that's pretty impressive just for the regular person, right? What we need is our children to not be on their screens as much. We need to have them outside more. And so I don't think that just this fitness test is something that's going to be appealing to children, because how are they going to get to running that 6.5-minute mile or doing those certain number of sit-ups and pull-ups, right?
Right. And as you talk about access to healthy food, I travel a lot, and in many places, it's food deserts for anything but the worst kinds of food.
Exactly.
But in 2013, then First Lady Michelle Obama started a Let's Move campaign intended to bring physical activity back to schools and advocating for healthy school lunches. She was ridiculed by the same conservatives who are now embracing the so-called MAHA agenda. So did they just not like the messenger, or is there something different about their health push and that one?
Yeah, and one of the reasons why the Obama administration got rid of the presidential fitness test was because there was a lot of body shaming and lack of inclusivity with it. And so Michelle Obama's program really was just to get kids to be more active, and that's what we want. So I do agree that it was the messenger and not the message that really was the cause for the pushback, because now we're looking at actually not even getting them active, just having them take a test, but not even preparing them for that test.
Now, this week, the administration announced it would experiment with Medicare and Medicaid coverage for weight loss drugs like Ozempic and Wegovy. I wrote an op-ed about why the government should do this a year ago, especially considering nearly half of Black Americans, including almost 60% of Black women, are living with obesity. If this does anything, indeed, and it becomes a reality, do you think it's a good idea?
So I do think it's a good idea. I think it's a good idea because these medications shouldn't necessarily be a privilege for those who can afford it, right? We need to make it affordable to everyone, right? And then also those disparities that you just mentioned are important. I will say, though, that the medication is amazing, but it is not a silver bullet because we need to, again, address all of those other root causes of obesity, too. So the medication is one piece of it, but we really need to make sure people have preventive services also and wraparound services. So it's the medication plus everything else. The thing I'm concerned about is with these Medicaid cuts that are upcoming, how many states are going to be able to afford paying for GLP-1s, right, or expanding it? Right. And right now, we know that there are about 13 states that cover GLP-1s. And this program, this pilot program, is actually voluntary. Oh. So one, it's voluntary. So we know that maybe certain states will do it and other states may not, which may actually widen the disparities even more.
Now, one last question before you go. Trump is making a big deal and show about MAHA, but many of the things the Republicans are bragging about, like putting sugar back in Coke, cooking fries in beef tallow, and getting rid of dyes in candy, are just changing the ingredients in junk food.
Right.
What are your thoughts about the overall message from this administration on nutrition? Will any of this really improve health care outcomes?
Yeah, no, I don't think so, because they're looking at these issues on a granular level instead of a structural level. So yes, I agree there shouldn't be these red food dyes that are responsible for causing cancer, right? But also we need to make sure that there's so many people in our country, mostly people of color, that are underinsured and uninsured. We need to take care of that, to make sure that people have access to preventive care, and that we're addressing, again, the systemic issues that impact our communities the most.
All right. Thank you, as always, Dr. Uche Blackstock, author of the book Legacy, a New York Times bestseller. And we will, in fact, be having you back.